Welcome to the recorded webinar of Inflammatory Bowel Disease and Nutrition. My name is Nicole Wake. I have a master's degree in nutrition and I'm a registered dietitian. I originally created this webinar to be for registered dietitians working with patients with inflammatory bowel disease, but this also works well for any physicians, gastrointestinal doctors, patients themselves should really know all of the information within this webinar. I think when patients are diagnosed with inflammatory bowel disease, they really need to become an expert in themselves, in nutrition, in the medication they're on, as well as a million other things from mental health, getting enough sleep, and financial management as well. So today we are going to be talking about overall nutrition with inflammatory bowel disease. So here's what we're going to be going over today. I'm going to do an overview of inflammatory bowel disease itself, the nutritional challenges for patients with inflammatory bowel disease from malnutrition due to either reduced intake due to pain or reduced absorption and nutrient deficiencies, nutrients supporting the immune function, nutrients for mucosal healing, and treating the IBD patient whether they have active inflammation or they are in remission. So the overview of autoimmunity in relation to IBD. A trigger could be something like the genetics. I know myself, I have Crohn's disease, and my father had type 1 diabetes, and there is a gene that is linked to both of those diseases. So a lot of patients with IBD tend to have genetic predisposition. I know that patients with Crohn's or ulcerative colitis, either their parents, their siblings, or their children also are at increased risk of getting IBD. Environmental triggers such as pollution, stress, anxiety, diet, all of those things could potentially play into the causality of getting IBD. This trigger, whatever it is, leads the body to elicit an immune response towards the intestines, and the immune cells release pro-inflammatory cytokines, which are meant to help fight the pathogen. However, in this case, the pathogen is healthy body cells. And in this process, there's a buildup of inflammation in the wall because of the pro-inflammatory cytokines, and the wall itself breaks down, which leads to a leaky gut scenario where things pass through, and it creates a cycle of the inflammatory immune response. So the medications for IBD are aimed at treating the overactive immune response towards the gut, which ultimately will lead to a reduction or elimination of inflammation and allows the gut mucosa to heal. And this is really where nutrition plays a role in the disease process and guiding towards healing and remaining in remission. So like I said, inflammatory bowel disease is an autoimmune disorder where the immune system attacks the cells of the GI tract, and the exact cause is not known, and that is because research has not got to that point. Research overall for inflammatory bowel disease is fairly young. Crohn's disease is the form of IBD that can impact anywhere in the GI tract from the mouth to the anus, and ulcerative colitis only impacts the colon and it is not segmented. However, patients who have ulcerative colitis could develop Crohn's disease as well. Often patients have extraintestinal manifestations, so other areas of the body will develop inflammation, such as the mouth has mouth sores, and other patients have developed arthritis and hepatic liver disease as well. Factors affecting nutrition in patients with IBD. The first one is difficulty with food consumption. Patients who are being newly diagnosed or worked up for the disease tends to be most foods, if not all foods, will cause pain and are difficult to digest. Particularly fruits and vegetables and other foods that are high in fiber will cause the most pain, leading to blockage type symptoms such as nausea, vomiting, diarrhea, excess bowel movements, or even constipation and bloating. So the difficulty with food consumption and then the the side effects, such as the pain and the diarrhea, can also lead to food aversions. I know myself, I have multiple food aversions just because they've caused me pain, and I also developed a smell aversion to certain foods for some reason, especially during, my initial stages with having Crohn's disease. Things like the smells of hazelnut or sauerkraut would actually make me feel physically ill just from the smell of it. And I relate that to, having pain, gastrointestinal pain often. Malabsorption is another factor that will affect the nutrition status of patients with IBD. Patients who have a lot of mucosal damage and inflammation in the intestinal lining will have various nutrient deficiencies because the intestine is not able to absorb the nutrients that they are consuming. And this is all dependent on where the inflammation and the damage is occurring in the GI tract as to which nutrients are deficient. And then nutritional deficiencies also can lead to other nutritional deficiencies, such as calcium helps absorb vitamin D, and so on. I wanted to overview the immune system and nutrition, the role nutrition plays in immune function. A healthy nutritional state without any deficiencies significantly improves immune function in any individual overall. A number of vitamins and minerals have a direct impact on the immune system, and I have listed those vitamins and minerals here, and they each play a different role. There have been some schools of thought that the immune system does not act properly because of immature immune cells getting involved, being released because they haven't developed properly. So if you have nutrient deficiencies, your immune system will not function or may overfunction. You may have excess immune cells. That is not scientifically proven. That is just one of the schools of thoughts. But these are all the vitamins and minerals that, if you're going to look for nutritional deficiencies in a patient or within yourself, these are the things that I would recommend getting your blood drawn to check to see what you have, so that once you have your inflammation in control, you can supplement or consume foods with higher doses of these vitamins. Macronutrients, for those of you who do not know, macronutrients are the nutrients in our diet that provide calories. So those macronutrients include carbohydrates, proteins, and fats. Each of these macronutrients plays a different role in our overall health and our GI tract, and then IBD impacts the different macronutrients as well. So carbohydrates, there's complex carbohydrates and simple carbohydrates. The complex carbohydrates are the ones that you think of as good for you in a normal, healthy individual. So whole grains, brown rice, wheat pasta. And then the simple carbohydrates are less healthy. So you're thinking candy bars, refined white bread, white pasta, white rice, those kinds of things. So complex carbohydrates tend to be difficult for patients with IBD to digest because it's more work on the GI tract. It bulks up the GI tract, and when you have inflammation, there's not much room for things to pass through. The complex carbohydrates, fiber, is actually good for your gut microbiome and can help in the healing process, and that's after your inflammation is taken control of, after you've taken control of your inflammation. Simple carbohydrates tend to be inflammatory and can lead to damage of the intestinal lining. But when you have active inflammation and active disease, these are the ones that are going to be easier to tolerate. They can also produce gas, so you want to be careful as to how much. Portion size is one of the most important things to think about. Protein, another macronutrient, has many healing properties for a damaged mucosal lining, and most patients with IBD are protein deficient because it is another food group that is very hard to digest when you have active inflammation. And also when you have active inflammation, you need more protein than a non-inflamed individual. As far as fats go, there's a lot of research to show that omega-3 fatty acids can reduce inflammation and are extremely healthy for patients with IBD and everybody. Your saturated trans and omega-6 fatty acids are the ones that you want to try to avoid or limit. And another note about fat, if you have inflammation in the terminal ileum, which is the area that connects the small intestine to the large intestine, it's going to be extremely hard for you to absorb the fat. And so when you eat a high-fat meal, it's going to cause a lot of pain, possibly diarrhea as well. In addition to certain nutrients being inflammatory or anti-inflammatory, there are specific nutrients that can help heal the mucosal lining as well. Now, when you have inflammatory bowel disease, you have inflammation and you also have ulceration on your intestines. And they're two different things. And you can reduce the inflammation but still have ulcers. The nutrients that help, there are two amino acids. Amino acids are the building blocks for protein. The amino acids are L-glutamine and arginine. There have been numerous studies to show that these do support mucosal healing. So some patients have supplemented with these in a powder form, like a protein powder. They specifically do sell like L-glutamine powders, arginine powders, that kind of thing. And also for nutrition, for wound healing in general, is also similar to healing the mucosal lining. So vitamins A, vitamin C, zinc, and having a high protein diet can help with the healing of the wounds in the intestines. And as you notice, those vitamins and minerals overlap with the ones that support immune function as well. There have been numerous diets that have been popularized by the IBD community, different books, different dietitians, nutritionists, mothers of kids who have had IBD. All of these types of people have created different diets, and some of them are better than others. They all have their different pros and cons. So the different diets that you may have heard of, the specific carbohydrate diet, which eliminates most starches, the Paleolithic diet, which is mostly, I believe it's mostly meat, the gluten-free diet, the low FODMAP diet, which is a very complex diet that allows certain fruits and vegetables, does not allow others based on the type of starches in them. And then there's many, many other diets. Per ESPEN guidelines, there is not enough evidence to suggest that these diets should be recommended for patients with IBD. Each diet has its own downfall, such as the gluten-free diet. You're going to reduce the access to certain nutrients by eliminating gluten from your diet. The low FODMAP diet is very hard to follow, and if a patient has strictures, it's extremely dangerous because too much fiber will cause a blockage. And in general, a lot of patients with IBD have trouble tolerating fiber. I know before I even knew I had IBD, I tried low FODMAP because everybody was like, maybe you have irritable bowel syndrome, and that's what the diet, they recommend for that. I tried it, I ended up in the ER because it basically blocked my intestines. So, recommending, it's important to, help your IBD patients or help yourself build a personal dietary approach, that you want to work with a dietitian, if you're a patient, to use their nutritional knowledge to help build a diet that'll give you the nutrients that you need and help you avoid the things that are going to cause you pain and discomfort. And also as a patient, you really need to focus on what foods have caused pain and discomfort, things that you don't tolerate, so that your dietitian can build your diet around that. Now, when it comes to having active inflammation, so this is anybody who is being newly diagnosed, has not started medication yet, has started medication and it's waiting to kick in, or somebody who has been in remission and is having a flare. Active inflammation, active disease, as they call it. Most people know that having a nutrition diet is extremely important. It helps, control obesity, stroke, diabetes, heart disease, reduce your risk of cancer, and so on and so forth. But what do you say to someone who can't tolerate fruits, vegetables, whole grains, nuts, and seeds? The first thing you have to do is find out if there are known foods that the patient can tolerate. Most patients do know that they can tolerate certain foods, and they will be able to identify that. It is very hard. You have to be patient and understand that especially a newly diagnosed patient, they have pain constantly, and unless they were to eliminate everything and eat only one food, are they going to know whether or not it causes them pain? So they may not know, but most patients can figure out at least one or two things. Step number 2, determine which foods the patient cannot tolerate, as it is definitely different for everybody, and it'll be easier for you as the dietitian to figure out which nutrients the patient's diet is likely lacking and possibly find alternatives to get those nutrients in that they're lacking. And number 3, be sure to not demonize processed foods. Patients with active inflammatory bowel disease may only be able to tolerate processed foods because it takes less effort on the gut to digest. Also, many patients may have developed food aversions due to bad experiences with certain foods or types of foods. This is the most important thing, and it's hard even as a patient because you hear your entire life, eat healthier, eat salads, eat fruits and vegetables, get your whole grains, eat beans, eat legumes. You hear this your whole life, and once you have a disease that makes it really hard to eat healthy, that stigma of eating unhealthy in front of people when they know you have a digestive disorder, it's really difficult. And so it's hard to remember that the most important thing is for you to be comfortable at this time, and that your medication, that your gastroenterologist puts you on, will eventually reduce your inflammation and get you to a point where you can eat healthier. The biggest thing is knowing that eating quote-unquote healthy foods could potentially make you sicker. So it is important to not demonize processed foods and to not beat yourself up for not being able to eat healthy at this time. The number one best advice that you can give a patient with inflammatory bowel disease, or to know if you have inflammatory bowel disease, is to watch your portion sizes. Generally, eating the size of your fist or your palm is what you should be eating at any given time, and then waiting an hour or 2 hours until you start to feel hungry to eat again, no matter what you're eating. The other thing is definitely opting for lower fat foods, no matter which type of disease you have. As I said before, with Crohn's disease, inflammation in the terminal ileum, where fat absorption takes place, will cause pain and diarrhea if you consume a high-fat food or meal. Patients with ulcerative colitis who tend to struggle with diarrhea, a too high fat intake will increase the amount of diarrhea. So it is important to opt for lower fat foods, no Chinese food at this time, and pizza, fried foods, avocados, too much oil, butters, those kinds of things. Making sure you're reducing the portion sizes when you eat them, and in general, anytime you eat, have a very small portion of the food. I want to stress that it's not realistic to expect remission to be achieved through diet. It is imperative that you continue to take your medication, or you encourage your patients to take their medication and continue to follow up with their GI doctor and follow their guidance until remission is achieved, inflammation is reduced, mucosal healing starts to take place, and then nutrition can be introduced to help maintain remission and potentially get you off your medication. It is extremely important. You cannot achieve remission through diet alone. Some examples of easy to digest foods to recommend for patients with active disease. Number 1, smoothies. The blending process takes some of the work off the GI tract, so smoothies can be a great way to help patients incorporate fruits and some vegetables into their diet. Protein powders, there are some good quality protein powders on the market. If the patient can tolerate dairy, going for a good whey protein, isolated whey, is a good way to help get protein in, as most patients can't tolerate meats and other forms of protein. Peanut butter and other nut butters, if they are not allergic, is a great way to get protein and healthy fats in. Again, keeping the portion size smaller because it is a higher fat food, so it can lead to those intolerances, but a tablespoon or 2 at a time should be okay. White or brown rice, I know from my own experience I could tolerate brown rice at the worst stage of my disease. Even though I was told to only eat white rice, I tried brown and I tolerated it fine. So either one of those is good. Sweet potatoes, cooking them really well, peeling them. I used to like to make sweet potato, I still do, make sweet potato fries. You just cut them thin, toss them with a little bit of oil, and then bake them until they're nice and tender. Also, grinding or pureeing foods can be a good way to get some more nutrition in meats and vegetables, for example. However, it may not be palatable. We are talking about people who have lived most of their life, or even if they're younger, they know what food texture is supposed to be, so it's very hard to accept that they would need ground meats or pureed food. I myself, even though I've worked with that food directly for a nursing home, I could not feed myself pureed meals at home. And it can, if you try it, it could potentially lead to another food aversion too if it is not a pleasurable experience. Tofu can be a great way to get some protein in that is very easy to digest, very tolerable. There are many different creative things you can do with tofu. Just be sure to look it up. The tofu and rice with some General Tso's sauce is pretty good. Cereal, refined cereals. Oftentimes this was my lunch when I was going through the worst stages of my disease, with either a non-dairy milk or a regular milk, depending on if the patient or yourself, if you're lactose intolerant, being sure to use either almond milk or soy milk, coconut milk, whatever, on your cereal. Soy milk is definitely preferred because it has protein in it, and I know, most patients with IBD can't consume most protein foods, so also it helps provide calcium too. And yogurt. It tends to be easier to digest even with a lactase deficiency because of the bacteria in the yogurt. It helps break it down, and the bacteria is beneficial for the gut. Some ideas of foods to avoid or foods to recommend avoiding if you're treating a patient with IBD. Carbonated beverages. Most patients with IBD tend to have an issue with bloating as it is. Introducing aerated water will cause more bloating and more pain. Caffeinated beverages. As the caffeine gets the GI tract moving more, it could potentially cause more spasmodic pain, move things through the GI tract too fast, causing pain at the ulcerations and the inflamed sites. Excess sugar can irritate the intestinal lining and cause more temporary inflammation. So making sure that most of the diet isn't from sugar, candy bars, sugary cereals, that kind of thing. Raw fruits and vegetables, again, too much bulk and too much work required on the GI tract to break it down and move it through. Again, dairy foods, if it is known that the patient has lactose intolerance, and then any other food that the patient or yourself has identified to be an issue or that you have some kind of weird aversion to. Now, once remission has been achieved and the patient does not have any strictures, they are able to start tolerating more foods, able to tolerate some more fiber, or the inflammation is down enough, it is imperative to start treating nutritional deficiencies. So step one, if you are a dietitian, reach out to the patient's primary care doctor or their gastroenterologist to have some blood work ordered for the specific vitamin and mineral deficiencies, particularly looking at the ones that I had said before for immune function. And then step two, determine how the patient is currently eating and look for gaps in protein, carbohydrates, fat consumption, and then work with the patient to determine what can and cannot be tolerated and be creative and innovative on ways to incorporate foods and supplements to help the patient reach optimal nutrition. So in summary, making sure you're working with the GI doctor and that you are knowledgeable of where the patient's inflammation is in the GI tract. Also, if you are the patient, be sure that you know where your inflammation is so that you can look up how that area impacts your ability to digest and absorb nutrients, and you can work with your dietitian to determine which foods you may be able to tolerate better because of this. Also know what medication the patient is taking and ask for all the nutrition-related labs to be drawn, particularly the ones that work with immune function. Now, insurance may not cover the lab draws, so make sure that you have somebody who's looking into that and that the patient is aware of this. Do not expect to correct nutritional deficiencies in a patient with active disease, as the digestive tract will not be able to absorb the nutrients no matter how many you give them. Work with the patient to find foods that can be tolerated. Calories are the most important thing during active disease. You want to avoid weight loss and get some nutrients into the patient no matter what they are. So again, no demonizing those processed foods. And once in remission, that's when you can really focus on correcting the diet and nutritional deficiencies to help maintain remission and potentially get off of medication. Patients with strictures must continue to follow a low-fiber diet. It's a typo in my slide. A low-fiber diet, and there is no one-size-fits-all approach for IBD. These are some of the resources that I used to create this PowerPoint presentation. I have read many different articles, and that definitely took part in some of this. I can't remember all of them, but these ones definitely have the information presented here within them. If you have any questions, be sure to comment on this video, and if you have suggestions or would like to hear more about another topic and related to inflammatory bowel disease, please let me know, and I will be doing more of these. So I'm going to leave this here, and I'll speak to you soon.